Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and we'll talk a little bit about high angle cases. Now, this, in case you're not sure about high angle, now they draw a line across here and then on your jaw down here, and when this angle gets extra large, your chin is away from your nose too much, and it messes up the appearance of the facial structure. And if you happen to have a high angle case and you close your mouth, it still looks like you've got too much room here. If you smile or just keep your mouth open and talking and smiling, people don't realize the high angle case. When you close it, it looks bad, but when you open it looks pretty normal. So let's get going on this high angle case. And it has we tried to get this down by reducing the number of teeth that you've got in here to resist it, and normally it would close some, but we didn't get very far with it. It's hard to get to reduce a high angle case by just doing the orthodontics. But let's get started, and I'll try to go over that with you and get you a little better understanding of high angle cases. And what happens on a high angle case, you've just got this angle coming from here, coming across here is too big, and you get the chin dropping further and further down, and it rotates around here, and your chin goes back. Like if you brought this up and closed it to where you'd like to have it, this point on the chin would be out further, and it looked like the lady has high enough, the angle would be low enough to do. And what we do on here is take out teeth that we can get rid of them without reducing it too much, and get the same amount of pressure on fewer teeth that it will lower this down in some cases. But this case didn't go like I wanted it to. So let's get started on it. And there is somebody who breathed through their mouth, you see, and the lip sits up here like you're breathing through the mouth, and you don't get enough length in the lip to cover it, and you have this gummy smile right in. You see that up there. You see that gumminess of the smile. So I'm going to erase that. That looks terrible. That's a high angle case. We'll try to get rid of that. Now this lady had she's a young lady, and she had a deciduous tooth that was more or less abscess, and somebody thought they had it cleaned out and everything, and they put a crown on it, and that is not the thing you want to do on these cases. It shoved the permanent tooth down way on the cortical bone in the lower jaw. So we'll see that when we get to the x-rays here. So we're going to come in and take out the second bicuspid, I believe that's on the case, and they take the deciduous molar out right here and go below it and take the bicuspid out also. Okay, here the case is crowded. We've got crowded cuspids, and by the way, we expand cuspids all over the place, and they don't come back as long as you keep the root distal to the crown. But if you just expand the cuspid down in here and just kind of lean them out this way, they'll come right back over a period of time. But when you move the root back, which takes you longer, and the cuspid is expanded, it tends to stay there. So let's look at what we did here. Now this is a pretty bad cephalometric picture, but you can see the chin is down here, and you got the way up here, and this is too much area in here. We would like to reduce that some. We weren't very successful in getting that done. Now here, this was in 79, and this baby tooth right here, I'm going to erase that so you can see it. This baby tooth had a big abscess in it, and they thought they cleaned it out and everything else, and they put a crown over this tooth, and then watch this tooth. It was coming straight up into there. Look at what it did to it. Now that's 79, and this is 85. In other words, so about 6 years later, this tooth was crowned right here, and it formed a cyst or something that pushed this tooth down and laid it down on the cortical bone of this tooth. And the same, they're having problems with this one too, but they can take that out, and you'll remove this and take this tooth. And in this particular case, we remove the wisdom teeth, so we've taken 8 teeth out here on this case to get it down, but still didn't take it down far enough for that. Let's go on back now. Look where this tooth is right here, and I'm going to erase that so you can see the tooth. And this was the little tooth. If I go back here, and you see this deciduous tooth here, and there that bicuspid is, and look where the bicuspid went. It pushed this bicuspid down. This is the cortical plate of the bone in the lower jaw, and this tooth is down in this area. So to get it back up here, we were glad we were going to be able to remove some teeth, so we're glad it's one of them. And we're going to take that, and then the 4 wisdom teeth and the 4 bicuspids. So we're taking out 8 permanent teeth to get this case down. Now, this is 1986. This was 85. A year later, we took that out, and now we move these molars up and close up that space in here, and we reduce the number of teeth so that the pressure of biting would intrude the teeth to some extent, and she may have been able to lower this over a period of time as she matured. Hopefully she did. So here we'll close the gaps up on this, and this is age 16 and 5 at this time. This is 87. Now the teeth are together good and lined up. We could bring these roots a little further up. They're working okay. Their teeth are setting where they're meeting good. She's got one lateral tooth there that's defective. It's had a root canal done on it, but apparently it's working all right. And here the case is, and it's age 18, and this other, then we have a 3-to-3 retainer on the case, holding the lower teeth in place. Now here is that tooth. You see, it was coming up like this, and they crowned this up here, and it formed a cyst that pushed this tooth down into the bone like that. Just magnified it and show you what actually happened in here. So when you get it out, we had an old surgeon, I think, went down and got the tooth out and everything. Now we've got a big gap back in there. We're going to close this up. And we use an intruding arch, and we're luring these teeth down and working off of the molar with that, and we're closing the space here. And we tried to reduce these teeth and get it to where she occluded on them and pushed the teeth and intruded the teeth more and lower the vertical dimension. And it may be over a period of time she was able to lower it to some extent. But now we've got everything together. We've still got a little gap on this, not completely. We take her out and put her in an upper retainer, and it's got a good overjet and overbite and everything. And we left the bands on those 6 teeth from cuspid to cuspid, and we'll come back and get something where we bond to the teeth. So this is working good in here. We'll come in and bond a 3-to-3 deal. That's what we normally do on this. So here at the end of 1985, this is kind of what we had to start with. She's got this short lip, so we have people stretch their lip so that they'll kind of develop the lip where it'll stay down further, and it hides the gumminess to the smile like that. Now here she is in 87, further down the line, and that's the starting position. And here it is, the finishing, where we got her down pretty good. We reduced it to some extent, and this is what we ended up with. So this is, when you close, it doesn't look as good, so we have people smile. And you're like that, if you smile, you don't recognize it that much. We want to thank you for watching this video, and maybe you'll understand high-angle cases where you've got too much space between the nose and the chin, and it's more than this space up here, and just a little bit more keeps the mouth. It makes the facial structure look not near as good. So if you have that and you can't lower it, if you just smile and talk with that, people don't realize you've got it that much. I'm going to hang up here now and close this out, and thanks for watching. And maybe we learned something about high-angle cases on this particular video.